best self. Don't come in and say...
I was going to say, what if you're an arrogant jerk?
Right, and there are some that come in and they go, this is why you need to accept me. Well, there might be some dental schools that actually like that, but I can tell you that we're not one of those dental schools, and the most of the dental schools, admissions and deans that I talk to really want someone that is just like what you're looking for when you graduate. The profession is looking for those new grads, just like we're looking for the new applicants that are hungry and humble. Those two words will be with you for all through dental school, all through the application process, and all through the application process when you graduate and get into your first couple of jobs. Those are two really, really important words, and that will come across naturally. And so just be your best self.
All right. Welcome, everybody.
Hey, everybody.
We are joined today by none other than Brad Smith, the Dean of Midwestern University. It's a real privilege to have him out here. We are at our our Legacy Summit out in awesome Belize. So behind us, you can see we're on a little island in Thatch Key. And we're just going to sit and chat a little bit about what's happening in dentistry and dental education, what's happening with Dr. Smith, and he's had a interesting transition going on right now, and so we'll talk a little bit about that and just see where the conversation goes. So a little bit of background on Dr. Smith. Dr. Smith was in private practice for
22 years
in California. He ran a really successful practice with he and his partner there. His family started moving to Arizona, and so he decided that he wanted to be where his kids were, moved to Arizona, happened to come into contact with the folks starting the dental school at Midwestern University, Glendale, and he then was brought on as faculty there, and long story short, he became the dean. When I was there, he was our pre-clinic dean, and he was someone that you could tell right away was really unique in his approach and was had a special level of concern about the students and about the welfare of the school, and that all translated over. So let's see, we met in 2008, so 14 years ago. So anything I missed on that?
No, that pretty much sums up my whole life since I was an adult.
That's adult. That's just what happens. That's adult Brad. So tell us a little bit about Midwestern. So for folks that don't know about Midwestern University School, College of Dental Medicine, give them a little background on the profile of the school.
So Midwestern is in Glendale, Arizona. When I first heard about Midwestern, I'd heard that there was a new dental school opening in Arizona. And one of my friends told me about it, who was actually at UNLV, and he had been practicing in Rockland, California, where I lived. And I told him, there's already a new dental school. It's been open for a while. It's called A.T. Still University. And he said, no, there's another new dental school opening. And so I had no idea about it. Midwestern University started with Dan's class in 2008. The last week in August of 2008, we matriculated 111 students, and that was the start of everything. We were very fortunate because we had a blank slate, being a new dental school. We did not want to be the traditional dental school because it was an opportunity to do something different. So we decided that we wanted to have a focus of a general practice. All of us that started the school were all general practitioners. So we looked at what do you need to be and what do you need to have as far as the curriculum goes beyond what the requirements were for CODA to have a successful dental school career, preparing you to walk right into any practice setting that you wanted to walk into, albeit, new beginner, but having enough experience and enough of the right experience to feel comfortable and confident walking into a practice setting. So that was our goal, and we really tried to maintain that goal. We've really tried to look at the curriculum, to stay ahead of the curriculum. So we focused way back 13 years ago on digital dentistry, on laser dentistry. We focused on patient care, on the human behavior side of care, on practice management, on running your office, on establishing systems, establishing protocols in your office. And I would say we've done a pretty good job. Education is education. When you're educating, 110 to now we have 145 in each class. It's not the same as if we were educating 2 people in an apprenticeship. And so there's going to be some that are really well versed in the things that we're talking about and get the why of everything. And others are going to be blessed just to, go along for the ride.
Yeah, so my experience there was really positive. Obviously it was different because I was part of the inaugural class. But one of the things that was really cool about being at Midwestern was how cutting edge everything was. So it was a constant drive towards getting us prepared to use the latest technology and hit the ground running. And so by the time we graduated, we were ready to just go. Like it was meant to be, four-handed dentistry. It was meant to be all the aspects that you would find in a private practice worked into the model of Midwestern. So that was something that I really appreciated and I really loved. And I still call on Brad a lot for like, hey, what's the deal with this technology or this product, or what's happening with these materials? And he's an encyclopedia for all those things.
Dan, I forgot to mention that one of the innovative things that we did was actually partnering our clinical students. Russ Kilpatrick was the dean before me, and he had come up with that idea of partnering students together. Then Dan's class actually came up with the idea of partnering 4th year and 3rd year students together, because we were going to partner 3rd year and 3rd year students together, which we initially did when we only had 3rd year students when we started. And then his class said, it would really help if there was a 4th year mentor with a 3rd year apprentice or protege. And that's worked out really well. It makes them more efficient, number one, but it also, the 4th year student then teaches the 3rd year student. And so understanding of dentistry, dental products, dental systems, really took kind of a leap, I think, in the positive direction.
Yeah. So what's new and what's happening at Midwestern now?
Well, I think the biggest thing that's happened at Midwestern is announcing my retirement. I mean, I think that's a big thing. Dr. Sherry Brownstein is going to take over my place as dean, and so I think anytime you have a change in the dean, that's a big thing. I think the systems that are in place are there to be in place. Everybody will always tweak things. I think that they'll continue to progress and do better than when I was there. I'm still there for a couple months. And I think what we're still looking at is the niche that we have is really digital dentistry, what's happening in the future, trying to stay on top of what's happening in the future, looking out 5, 6, 7 years and going, okay, where's dentistry going? And then we look at the practice management side. We look at how are DSOs doing and who fits in a DSO, and do we want to partner with DSOs? And personally, I like some of the DSOs. I think for some of our students, it's a great fit. For others, it's a horrible fit. I just think the same with ownership of a practice. For some students, it's a great fit. For others, it's going to be a horrible fit. And it all depends on the personality and the energy of the individual, rather than just a blanket, okay, we're just going to do this for everybody.
So I guess that kind of, we're come back and talk about some of those things. So prospective students that are watching this, or current students that are watching this, we're going to go back and talk about some of those hot button topics like DSOs. So we kind of hit on, what makes Midwestern, different. But, so how many students are at Midwestern right now?
So we have 580 total students in Midwestern.
So how many per class? New math.
145 per class.
So pretty good sized school.
Yeah, make sure my math was okay. It's 580.
What's it take to get? So if I'm in undergrad and I'm like, yeah, I want to go to dental school. What does it take to get into? I know you can't speak to all dental schools, but what does it take to get into Midwestern University?
Okay, well, I think generally I can speak to all dental schools because we're all looking at a GPA of a general GPA and a non-science GPA, and for the dental admissions test. So everyone kind of has those two standards, and they each have a level that they like to look at. And I won't say what it is for any of the schools because it varies for every school. Then in addition to that, I think everyone looks at the kind of experience that you have. So, a minimum of shadowing experience, and that's really a minimum because shadowing is, you're standing back and you're kind of looking and you're going, yeah, maybe I like dentistry, maybe I don't. We really like work experience. We actually like students that are coming in or candidates that are coming in that actually have worked in the workplace, even if it's not in a dental workplace, and maybe for a year or 2 or 4 or 5, because they understand the work ethic. And the more they understand the work ethic, the more committed they are to learning the why of everything that we're doing when we're in school, instead of just being a student. So it's really important to move from, when you go into any professional program, move from a student to the professional that you want to be as early as you can into the system, because there is a psychological difference for that, and you actually will get leaps and bounds of information and knowledge that will prepare you for the future. So I'd say that thing. Now, if you're working in the dental profession as a dental assistant, wonderful. That's a plus for us. If you're a dental hygienist, plus for us, because you're actually working hands-on. You can see things from start to finish, but you also understand patient-provider relationship and the importance of getting along with your patients, helping your patients, being in a team. That's really, really important, because dentistry, wherever you serve in dentistry, you're in a team. And if you fit well in a team, you'll fit well in dentistry. If you're an isolated person, that's going to be hard, at least in the dentistry in the United States.
So going back to, you obviously have to have some core classes that are standard, sciences, your basic sciences have to be covered. What are you guys looking for as far as, I know when I was applying to dental school, there was all sorts of talk about, this school weights this particular subject more, and this one weights this one more. And I don't know how true all of that really was. I think a lot of that came through way of maybe some websites and studentdoctor.net and all of that stuff that maybe was a little inaccurate. But is that true, or does Midwestern weight any particular thing more than another? I mean, obviously you talked about work experience, maybe a little bit of life of experience in there, but as far as curriculum goes, do you guys weight anything more than
we do not weight any of the undergraduate courses heavier than any other course with the same GPA or same grade in a course. We're looking at the ability to learn, number one, the ability to understand, because we have a very fast-paced basic science curriculum and oral health science curriculum, very, very fast-paced. So if you don't have a good background in, organic chemistry, biochemistry, inorganic chemistry, physiology, anatomy, microbiology, those kind of things, and it's kind of coming at you new again, it'll be really overwhelming to you. But if it's coming at you for the second time or maybe the third time, then you can pick out, what the important things are that you're going to need to learn in order to be prepared to treat patients and pass tests.
Yeah, I think I remember during our pathology classes at Midwestern, we had a fantastic pathology professor, and it was the same curriculum as the medical school, and she went so fast I'm pretty sure I could smell smoke in the room from us riding as fast as we possibly could, because she was so rapid fire. And I have to say a funny story about that a medical student raised her hand during a class and said, she was talking about oncology and some of the cancers and stuff, and she said, "Does anything not cause cancer?" And she says, "No, everything causes cancer." So,
She's the same instructor where I've never sat through one of her lectures, so this is the feedback I get. So we always used to tell our instructors, have between 35 and 50 slides in your 50-minute presentation, no more than that, because you really can't get into answering questions. And I remember one lecture, she had 260 slides.
Yeah, she took it
for
as a
one
challenge.
50-minute lecture.
It was insane. So the bottom line is, you better be prepared.
Yeah.
To know what you're getting into, otherwise you're going to struggle. So with that in mind, and hopefully this is going to be helpful to a lot of prospective students, what are some of the common mistakes that you see prospective students make, like incoming, applying, or just mistakes that they make along the pathway of trying to get into get to dental school? What are some of the mistakes that you like, I wish they wouldn't do this? Or if you could give advice to someone that's coming along and say, yeah, this is the common mistake we see made, don't waste your time on this, or whatever.
Well, there's always the kind of obvious ones, but I will say, with everything and everybody, there are exceptions to the rule. Don't be the exception, right? Don't be the one that says, yeah, I have a 20-year criminal history record and I'm going to get into a professional program. Maybe that might happen to one person somewhere along the line. And so then you think, well, that happened to the one person, so the precedent set, so I can get in. That's not the case. So we definitely, every school has criminal background checks. If it's a misdemeanor or something like that, you were stupid one night, I'm not going to get into all those kind of things. Can that be, part of not weighing as heavily? Maybe, there are issues like that. But I would say, be really careful about the things you do. Be really careful about closing any doors, criminally speaking, and losing control of yourself, and then having, a really bad night, and there you are, you're facing the DA and you're plea bargaining, and then it's on your record. So, that I would say, be really careful about that. Got a little quad coming through here.
We are in a working resort, so we can't control the birds or apparently the four-wheelers either. So we needed a new washer and dryer, so here it is. We got ants crawling on me too.
So I would say that would close some doors. I would say the kind of experiences that you've had really will come through in an application in any dental school curriculum, but especially ours. So we're looking for students that have had a diverse experience with a diverse population, because that is what we get into when we practice in dentistry. So all of our admissions team, all of our preclinical and clinical faculty, all have had clinical experience anywhere from, I would say the average right now is probably 15 to 20 years of clinical experience. So with that experience, there's that whole human behavior side of dentistry. And that's how you interact with people. And so we're looking for things in the candidate's application that shows us that they can talk to people, they can interact with people, they like people, because this is a people profession.
I know that I think one of the places that can get you shot down into getting into any particular school more than another is the interview. And you may be God's gift to the DAT and GPA, but if you tell people that you're God's gift to the DAT and the GPA, you're going to have a rough time getting into places. It's, I think there's a component of being personable and not too high on yourself. I think you need to have confidence, right? But not maybe arrogance. It's probably not the best thing.
So I would say this about that is just be yourself. Most admissions committees have been doing this for a long time. I'd say be your best self. don't come in and
I was
say,
going to say, what if you're an arrogant jerk?
right. And there are some that come in and they go, this is why you need to accept me. Well, there might be some dental schools that actually like that, but I can tell you that we're not one of those dental schools. And the most of the dental schools, admissions and deans that I talk to really want someone that is just like what you're looking for when you graduate. The profession is looking for those new grads, just like we're looking for the new applicants that are hungry and humble. Those two words will be with you for all through dental school, all through the application process, and all through the application process when you graduate and get into your first couple of jobs. Those are two really, really important words, and that will come across naturally. And so just be your best self. Don't be worried so much about the interview if you're your best self. Now, if your best self is horrible, then fake it. So, but
They'll see through you.
yeah, but don't, so I hear all the time and I read all the time on Student Doctor Network, hey, this dental school, here's the questions and here's how you need to answer the questions to get in. Now, that is really, it's not an honest assumption to make. Just be yourself.
So what are some of the other myths that you hear about getting into dental school? Like, so obviously I heard that one too. Like, so when I interviewed at Marquette, I did get asked some odd questions, like to throw me off. And I think that that's probably the game of some of the admissions. They want to see if you can think on your feet. But I also heard that like there were certain things that at certain schools that they wanted to hear. And then when I talked to people that, once I was in dental school and talked to people that had actually been at those schools, they're like, no, that's not true. So what are some of the other myths that you hear bouncing around about getting into dental school or the admissions process?
I won't really say myths, just a really good interviewer, whether they're in the workplace or whether they're in the application process in a school, whatever, a really good interviewer wants to have a conversation with you. And they want to be able to pull out the things that you're hiding, the things that are deep in your personality that you've really practiced at polishing up and overcoming during a 5, 10, 15, 20-minute interview, whatever it might be. And so they're going to ask questions. They've created questions that tend to make you think and kind of throw you off just a little bit from the polished answer that you already have come up with based on what others have said. That's most admissions committees, most interview processes that we're talking about all across the board. A really good, like I said, repeat, a really good interviewer in a short period of time is going to know who they're dealing with and what their core beliefs and values are, especially when it comes to working with other people, caring about other people, and dedication to the profession and also to the program and getting through the program.
So I've gone to, I'm a new prospective student. I take the DAT, I have a GPA, I do the interview, I get into Midwestern. Now what? What should I expect moving forward?
Work your tail off. Here's the difference between a student and a professional, or a professional that's still in the non-licensed phase. Okay, that's what I like to say. Is a professional and someone that really wants to increase and expand their career and continue to grow is always going to ask the question, why? Why are you doing this? Why am I learning this? How is this going to benefit me in my practice? And I know a lot of you won't have experience in practice, but for every time you learn something new, you should be asking, how is this going to help me in my practice? And if the instructor can't answer that, you need to go to another instructor that's not part of that course or not part of the class that you're taking. And you go, I learned this for right now, and I'm just trying to figure out how is this pertinent to dental practice? And so if you always take that philosophy, like from day one, I'm a dentist and I'm learning to be the best dentist I can be, the best professional I can be, you will be leaps and bounds ahead of your colleagues. Now, here's the opposite. I'm a student in undergrad, and I got where I could cheat really good, and no one's ever found out that I've cheated. Now, for all of you listening out there, we all know statistically that 90% of you have cheated, and I bet you that's off just a little bit, and it's probably low. To some form or extent, and if you get offended by what I just said, then you probably are just slicker at cheating. And I will say that that's going to go on in many forms through professional school and going on in practice. I remember walking out of a continuing education ADA conference and having a colleague go, "Oh, what was the number of that course?" Because I didn't want to go sit through that course. And I'm thinking, you're a licensed dentist, you took a Hippocratic oath to be ethical, and now you're asking me for the number for a CE course because you got to have so many CE credits to be able to get relicensed, and you didn't even go to the course. So, that kind of philosophy goes right through you. And sometimes you get caught and sometimes you don't. You know that. But I'm going to just say that being a lifelong learner and a true desire to not worry about what your peers are doing, because everybody's going to be on a different gradient, but worrying about how can I be the best person that I can be, the best dentist that I can be, and that's going to come across to your patients. And if you're trying to be the best dentist that you can be, and you're trying to help your patient to be as healthy as they can be and not take advantage of them, you will always have an abundance of patients. I don't care where you are, everyone will want to come to you because they can see your honesty and your integrity, and that will just draw people into your practice. You will always be busy.
I mean, I freaking love that. I think a call out to, being ethical and being, moral in our practices and what we do. I think so there it is. Call out from the dean to all of us professionals or prospective professionals to I think, elevate our profession. That's been one of my big pet peeves, is anybody that cheapens our profession, I get really salty about, because it's one of those things that I think so many of us work hard to dignify and make it an honorary profession. We've dropped from being, we used to be top 3 trusted professions, and it's dropped because it's been cheapened, and it's been cheapened because of unethical or unethical or immoral behaviors and practices. And so I love that. I think that's a call out. And if we can get it instilled in this, I've heard you can't teach ethics, right? But I think you can teach ethical behavior. And so to have that call out to people that are going into the profession from the beginning, I think is rad. And I think that's important. So I love that. So as new students are coming in, and what should they expect? So heavy curriculum, we talked about that. Pretty tough testing. Testing is always testing doesn't change. It's going to be the same. You're going to get tested. But what should they expect as far as like licensing and debt and training, on clinical training? What's that look like? So what should they expect with all that stuff?
Okay, so I'm going to back up to using that question and the previous one too. One of the things that as dentists that we started and we talked about right when we started the program was, what could we do to prepare our students to pay their debt off, or be prepared to earn a living in such a way that's going to help them prepare and pay their debt off in some form or fashion. And I'll get into so many different ways you can pay your debt and what kind of debt you're going to be in. And that was, how can we prepare through experiences and leapfrog that first year? And so for those students that really go out of their way to ask the why questions and take everything in that we have as far as Midwestern goes, they're really going to jump out and be equivalent to a first or second year graduate. And that's just what we hear back from employers. And I think the top students in every school, maybe the top 10%, and I don't mean top 10% GPA wise, I mean top 10% that are professionally prepared, and have taken advantage of all the curriculum in every school that they go to are probably going to be able to jump out and be that year or two ahead of the student that's just, I want a degree type of student. So, what can you expect? We, in the preclinical time period, we give over 2,000 hand skill procedures to students, and we are exposing our students to everything that's in dentistry in the preclinical time period, and then we do the same thing in the clinical time period. We're looking, because we are efficient, because we have students that are paired together, because we're fortunate to be in an area that has a lot of patients, our students get a lot of clinical experience. And so I think that's really important, because for every time you get experience, whether you're watching it or whether you're doing it, then you can kind of formulate like, okay, in this kind of situation, I can treatment plan this and it's going to turn out this way. And that's what dentistry is all about, is I want to know the end from the beginning, so that when I tell a patient, hey, we're going to do ABC, I know that it's going to lead to a successful D outcome. And that's what I want. And that's what the patient wants too. They want to know that you're going to be able to do that. Mm-hmm. So how does, student loan debt and everything come into play? Well, there's two kinds of debt, and I had actually a practice a financial planner talk to me about this, that the psychology of debt. And so I'll just quickly get into it. There's two kinds of people. There's one that like, oh my goodness, I have debt. I can't go to sleep. I can't eat. I got to get rid of this debt. It's overwhelming to me. I wake up in the morning and all I'm thinking about is the debt. That's one kind of personality. And then the other one is like, debt? What debt? Oh, who cares? I don't have any debt. We're going to make the minimum payment. Oh, government's waiving our interest rate. Great. I'm just not going to pay anything right now. Those are the two kinds of people that there are. So, and there's multiple schools, right? So you have schools like us, and our tuition is on the higher end of the tuitions for all the dental schools. And then you have those that are in-state residents. So you have to be careful, because if you're an out-of-state resident going to a state school, a few of them will give you the state residence after first year, but some of them don't. Some of them you have to go all 4 years now as an out-of-state resident. And so there's a lot of dental schools where they're equivalent as far as debt that you get into. But you can go to school and have debt from school, not living expenses, debt from school, and get out of school for $120,000, or you could be $550,000 in debt. And so there's a big broad range of that debt, and that can be overwhelming to you. The majority of students, and you'll see the statistics and know them, majority of students nowadays are going to get out with over $300,000 in debt, and that includes living allowance. And it's going to be towards the high threes, even approaching fours for the majority of students. And so you have to have some kind of plan to pay that debt back.
So we were talking, Brad, you and I were talking during this trip about that same thing, and about how that same financial advisor and you were talking, and I think that we discussed how you have to watch out for this loan forgiveness idea of like, just let it ride, I'm going to get it forgiven. Why is that? Why is that not necessarily the best idea, just to let ride that out and make the minimum payment, or
So again, it comes down to the personality. You can do that if you trust the government. There are many cases right now where there are a lot of people waiting to receive that loan forgiveness. They've done everything they should, and they're kind of being stalled from getting that forgiveness. Whether you're forgiven or not, that's one thing. I think that there are some students that have paid everything they should, or maybe they defaulted on one payment, but it was okay for them to fall on one payment, or miss one payment, or late on one payment, I should say. And then the government says, nope, you missed everything. Well, that's kind of gone back in through the Congress, and they've made some changes to that. But I think it comes down to this. The IRS doesn't forgive any of that, right? So if you're forgiven of, let's say, $500,000 in debt, great. You don't need to pay that $500,000 back to the government. However, you need to pay the tax on the gift that the government has given you of $500,000 when you are forgiven. And so if you're $500,000, that would probably put you in the 33% tax bracket, 30% at minimum, maybe even 36%. And so you're looking, that at $500,000, you might have a couple $100,000 immediate payment to the IRS. And so it's important, if you're planning on doing that, to also plan a separate 401k or IRA account that you can borrow from or you can take to pay that debt off when that time comes. And then whatever money you have extra over that would just continue to build your retirement.
Yeah, it's sucked to get blindsided by that and not know that you're getting blindsided by that. So what about it's funny, there's a couple tests you have to take once you're in dental school to get your license. Talk a little bit about, so what are the, you obviously have your tests, you got to pass all your tests, get your degree, but on top of that, and one of the things that I really liked about Midwestern was the time that I had to study for my part 1 of the boards, and I liked that it was at the end of the first year. Is that still being done? It was shifted it?
Right.
So, too bad. I liked it.
Yeah. So every dental student, and especially all you prospective ones, the Part 1 and Part 2 national boards are being phased out, and if you're prospective, you won't ever face that. You're going to face the integrated national boards. So this is the first year that our students all have taken the integrated national board. We planned this 5 years ago, that this would be the first year that they would take it, as soon as the ADA and the testing centers said that they were going to have an integrated national board, and then when it would be eligible. Last year in 2021 was the first year eligible for dental students to take the integrated national board. So that's replacing Part 1 and Part 2 of the national board. So the integrated national board, and we've had all of our students this year have taken that, and with a very high success rate. And it's more clinically based. So that board is specifically designed that a general dentist in practice right now should be able to answer the question sufficient enough to pass that test without having to study for it, just based on the experiences that they've had and the daily work that they go through. Other than oral pathology and pharmacology, which can get into the weeds a little bit, and you have to kind of study for that, that's pretty much the case. And it's been a really fair test for everybody. So that's the national didactic written portion. And then it's been that there's been several different testing agencies for hand skill portions, and the hand skills are really changing because of COVID, and they're going to stay changed. But now the CDCA, or for ADEX, examination body, is the body that's now testing the hand skills of applicants in all 50 states. And the goal for everyone is to have portability of licensure. So portability with the testing agency, portability with the national testing agency, and then portability in licensure from one state to another state without having to relicense, retest, or anything like that. And that's coming, and it's in the process right now. The portability issue is a big issue. The testing issue is a big issue. And then on the test, whether you have a patient or not is a big issue. Patient testing, so single experience patient testing is going away. And that's just extremely stressful on students, because in the past, if your patient didn't show up, you failed. And then you would have to go to a new location and pay again to take that test, and it was no fault of your own. That patient just decided to not show up. Or the patient came in and said, I know this is a high stakes exam, and if you don't have me today, you fail. So guess what? I cost $2,000 today. Go to your ATM, go to your parents or whatever. And that happened enough that it was very evident to everybody. That's all going away right now. And so they're looking at mannequin portions right now. The ADEX has what they call a compodont tooth, and it's a pretty well designed ivorine tooth that cuts like enamel, but they can by printing these things determine how much decay is in each tooth, and it's variant. So you don't know how much decay you're going to get in that particular tooth, and it's actually a little bit more difficult than a natural tooth. And so it's pretty good, and they're doing that with the perio. The prosthodontic portion, the endodontic portion is all on plastic or ivorine teeth right now. So everything's moving away from needing a patient.
Which is cool. That was really stressful. I think anybody that's, had to take those tests, and it's been that way for years now, where I had classmates that were paying, potential board patients quite a bit to come and do that, and it was pretty crappy that if you got. I can't imagine how it would be with COVID. I mean, that would be not fun. So what do you think? What do you see as being the most common or maybe costly, whatever that means, costly mistakes that new graduates make? So if I'm coming out of school now, I'm there, I made it. So what are the mistakes that you're seeing being made coming out of school?
You can make up for getting into a practice situation that you really didn't like, and then having to leave after 6 months or a year. And you can make up for that over time. It depends on the contract that you have. So there are some things there. But I would say the biggest, costliest mistake is accumulating more debt and more consumer debt. So there's smart debt, and I'm not going to get into me personally, not being a financial planner, but just looking and working through this myself and looking at others. There's smart debt. I don't want to get into all that, but like owning a home versus renting, that depends on what you want to do. But, we have students that'll go out, and other programs have students that'll go out and they're going to buy their first home. They have student loan debt. Then they're going to get their new Mercedes or whatever other, luxury car you want. But then they have to have two of those, right? If they happen to have a significant other, because you both need to have that really nice car. And then, you're going on expensive trips, not like Belize here isn't a little expensive. This is really cheap.
Very affordable.
And so accumulating more debt when you don't have to right away is probably the worst mistake, because then it locks you into having to make money to pay that consumer debt off, and that keeps you maybe at a job you don't want to be at, or it then tugs on your unethical side. You got the little voice over here saying, do what's right, and then you have a little voice over here like, just get the money, and so you just have to be careful. The more debt you're in, the more you listen to this one over here.
Yeah, I think that debt will sit on you like a giant elephant and can cause a lot of stress problems. Oh man, for sure. So
I'll jump in one more thing about that. Your initial contracts. Initial contracts.
I think I was going to touch on that.
There's two things that you want to really be careful of. An early buyout, like if you leave for any reason, you have to pay back money in whatever form, and some of it's hidden. Those contracts, stay away from. If you have no other option but to get into that place, move to a different state. Even if you don't want to move to a different state, do not get into a contract that has an early buyout option. Not an early buyout, but a penalty buyout if you leave early or you get fired or something like that, or you have to repay the lab bill. Anything where you have to pay money back to the owner doc or the corporation or whatever it might be, shy away from those things. That's number one.
As an associate.
As an associate. You can pretty well get away from everything else. Now, you never want to have to go, like you can hear this one. Well, I heard you can't enforce a non-compete or a certain zone where you can't practice, because they just can't. There's precedent where you can't enforce that. Well, that's true, but you have to go to court to be able to not enforce that, right? So how much is it going to cost you in time and money to go to court? And these people know that, and so they put that in there, and they're enforcing it on you until the court says you can't enforce that. And usually what happens is you get tired or your attorney says it's not worth it. Just move out of that zone. So be really careful about zone of non-competition.
Yep. We could get into that would be another discussion, but just holy cow, there's so much that goes into like knowing your contracts, knowing what area you're going into, understanding your non-competes, like what you're going to be paid on. We'll do a series on that to talk about some of the options that are available as far as, when you can do once you graduate, what to look for, what a bad contract looks like, know how someone's trying to take advantage of you, all that stuff. We'll get into that in a different discussion, but while and Brad knows a lot about that stuff, but I'm going to tap into a little bit more of his experience and knowledge as dean. So any advice to students that want to specialize? This was always everyone wants to be an oral surgeon when they go into dental school. You talk to, I think it's half the class, right? It's like, oral surgery, I'm going to do oral surgery. And then they get thinking that they have to do 6 more years after that. And by 3rd year, you don't want to be an oral surgeon anymore. But there are a lot of options. And for some people, they really do want to become a specialist. And so what advice do you have for someone that is seeking to become a specialist?
Well, this is the first time in 40 years, in the last 3 or 4 years, that I've actually had students, my own students or other students, where you'll have 1 or 2. Now, I'll put a big comma there. The residency programs probably know better than I do of the number that do this, but have actually dropped out after a couple of years of a residency program because it just wasn't what they thought it was going to be. And so, number one, if you're going to go into a residency program, just make sure that you're passionate about that is what I want to do. I love it. And make sure it's got the LOVEIT, love it. And if that's what you want to do, go for it. Now, number one on that one, man, GPA and class rank. And if go to school doesn't have a GPA, class rank. Class rank, class rank, class rank, class rank, class rank. I can't say enough about that. I can get in. I heard someone with a class rank of 70 out of 80 got in. Okay, well then their mother-in-law or something like that was the resident director and they got them in, right? So class rank for different of these residencies is different. And if you're going to go to ortho, oral surgery, those two, you're looking at top 10 class rank. Top 20 is stretching it, right? Above top 20, you're the exception to the rule. There's a lot of other things that can get you in, but class rank is number one. Research. Not every residency program does research, but a lot of them do research. Number 3, work ethic. So residencies produce the vast majority of revenue for the dental clinic portion of a dental school, not the pre-doc program, okay, not the general dentistry program, but it's those that are licensed already and they're going in there learning how to be an endodontist, but they are doing a lot of endo on patients, producing revenue. And so if you have a previous work experience or work ethic, that's something that will allow you to get in as well. And then great letters of recommendation that are honest letters. Get to know your faculty. Get to know the specialist. Start in the very first year. Belong to clubs. Show that you can handle a big workload. You can handle the pre-doc program, and you can be like a ASDA president or ASDA member or a AGD or the endodontic study club that you have, or the ortho study club, whatever it might be. Go to the meetings. Usually you can go to these meetings for free or very little, and you can go maybe to the American Association of Oral Maxillofacial Surgeons because you want to be an oral surgeon. Go to their annual meetings and put that down on your resume that you did that. Those are things that will help you get in, and plus networking. So you go to these meetings and you're going to see, the directors of the residency programs at all these different meetings. They usually go there. And, you can kind of rub shoulders, and they might not know you the first meeting. The second meeting, they're probably going to know you. And then you can always do internships. So internships are going to be in your 3rd year. You go for a week or maybe 2 weeks, and you go to a program, and you can look at that. Now, let's say you don't get into a program. then you can go to either a GPR or an internship. For instance, if you're an oral surgeon, you could go to a non-categorical 1-year internship at a residency program for oral maxillofacial surgeons, and they're like a feeder program. You didn't have the class rank, you were just outside of that bubble, right? And so, but now they're accepting, great candidates that are just outside that bubble, and now they're going to feed you into that program.
Perfect. But if you're planning on going straight out of dental school, class rank, GPA. So let me ask you this: are there too many dental schools? That's a hot button topic right now, right? So if you're a prospective dental student, there's not enough. If you've graduated, that's something I keep hearing. That there's concern that there's too many dental schools now. They're producing too many dentists. Where the areas are saturated and there's already too much competition. And why are they opening more? Is there too many dental schools?
So that is a no and a yes, just like you said, right? It just depends on who you talk to. Supply and demand says, no, there are not too many dental schools. There are other professions that have a 1-to-1 applicant to seat ratio. That's not the way it is. We have about, and I don't know the last numbers this year because there's some new dental schools coming online, about 5,800 to 6,000 total seats, somewhere around that number, and about 10,200 applicants. And so the closer that gets to 1-to-1, the lower the GPA can be to get into a dental school. But as long as it's up at that level, you're going to see dental schools opening up because there's a need. Now, the ADA probably has the best statistics on everything. Here's my statistics. Even when there was a real extreme shortage of dentists, there were always those areas where there was never a shortage. I mean geographical areas. So there are plenty of areas right now that are in need of a dentist, and your reimbursement is really good because they just need you to be there. And then there are other areas that when you get out of school, you're going to be making $100,000. And that's going to be your salary, and you're on the very, very low end because everything is oversaturated in that particular area. And so that's kind of a yes and
a yes
no.
No. It's definitely a yes no. Yeah, I mean, and it's interesting, right? Supply and demand. That schools shut down in the 80s. Now we're kind of on the ramp up phase of things. I will say this: that if part of what we do is we do a lot of analytics. Man, if you want to practice, if you're okay with practicing rural, world is your oyster right now. Rural is gagging for dentists, and to the point where their states are passing laws to allow for more expanded. Brad, what's the term? I'm just pulled a blank. Expanded
dental assistants.
Yeah,
and hygienists.
Mm-hmm. So you just know that. If you're up for that, it's a good way to pay off debt. There's programs that are available to you. We haven't touched a whole lot on scholarships, but military scholarships are available, and there's ways to go and find more experience residencies through that way. That's a pathway. A lot of stuff. So
can I say this too about scholarships? Whatever school you plan on going to, apply for every single scholarship. I mean, we're not as well endowed monetarily wise because we're a new school. Now we're not a new school when it comes to medicine. We're 100 years old about, but we're a new school for dentistry. So we don't have what some of the other schools have as far as endowments. But we'll have a scholarship that'll pay like $5,000, and we'll have like 6 people apply for it. And I'm like, what? 6? And I just don't get that. So wherever you go to school and you think, well, I don't think about this $1,250 scholarship. No, apply for all the $1,250 scholarships all the time you can, every year you can, or 1,000 or 500. I don't care what it is. Apply for everything. The more scholarships you get, the less debt you have.
Why turn your nose up at free money?
I know.
I applied for a bunch. I tried to get everything I could get my hands on. So, and there's a lot of cool programs that are available if you are willing to make some compromises on what you're going to do. I have I could ask you 1,000 questions, but I want to touch a little bit on So Dr. Smith has a real passion for service, and he's someone that is incredibly giving. He and his wife Sherry are someone that believe in giving back to the world this gift of dentistry that we've been given. And so if you could just take a second to talk a little bit about the humanitarian aid projects you've been involved with, obviously the one in Tonga, you've done other ones, the one that we're starting up with, we don't need to get into Tanzania too much, but if you could talk a little bit about those and your thoughts on all that stuff.
So it's been my experience that there's going to be a point in your career where you're just going to feel burnout. And I don't know any dentist that doesn't feel like that. It might even happen in dental school. And that's okay. It just comes with the territory. And it really doesn't matter what profession you're in. There always comes that time where things become rote, routine, and you think, why am I doing this? And it's like, I got to get up for work. When you say, I got to get up for work, then it's time to look at, like, why are you doing this? And so I'll always tell the students that graduate, I don't always tell this, but I'll give a little talk for those that are awake while I'm talking about this at a graduation banquet. And I'll go, when you feel burnout, go serve somewhere, do some humanitarian work somewhere for free. And when you do that, you're going to find out, like, oh my goodness, I have a gift that can help people that could not be helped, and there's no money involved in it. I might even be paying a lot of money to go do this. That will bring all the reasons why you want to be a dentist back into the forefront of your mind, and it'll re-energize you like nothing else. So I think the very first humanitarian project I ever went on was to a couple places in Mexico, Puerto Vallarta, Guadalajara, because I speak Spanish fluently. And those were great 1 week, 3-day trips, and there's a lot of those that are going on all over the place. And then through association I belonged to, I was signed up to go to Uganda for a 3-week trip. And that was right at the time when the dental school opened. And so I postponed that one. But I talked to one of the directors about taking dental students, and he said, that's a possibility in a lot of countries. So the second year that we were in dental school, I approached one of the directors that was an area director over the South Pacific area and said, hey, you're showing that you have a real need to go to the Kingdom of Tonga. Can some faculty take students over there and go and do the work in this free clinic you had? And he said, well, let me check with the government. And they checked and said, yeah, as long as you're under direct supervision of the faculty, and the faculty have to get licensed. It's a really short application process, but we did. And we have an annual license that we would get over there. And we took probably 20 to 25 trips semi-annually to quarterly over to Tonga and work for free over there. And then the Samoan docs heard about that, and so they asked us to come over there. So then we started over in Samoa, and we started 2 free clinics in Tonga and Samoa. And then we reached out into Jamaica. Jamaica wasn't quite as good for us and the students, so we only took 2 trips over there. And then down to Guatemala, which is really close to where we are right now. And now we're working on one, and Dan and Jared and Ryan have really taken the lead on going over to Tanzania. And there's 2 cities over in Tanzania, Malangwe and Itigi, that are destitute for dentists. Never ever had a dentist over there. There's so many parts of the world that have never ever seen a dentist in generations. And I'm really excited for them to be able to help these people and start something that will be a legacy for generations to come.
Mm-hmm. We'll talk a lot more about that. We'll get Mike Dosek in one of these podcasts and chat with him. It was a relationship that was formed by way of tragedy, actually, that started this whole thing, and we've created something pretty positive from what started off not so great. And Dr. Smith's been incredibly instrumental in getting key players involved and quarterbacking this organization that we've then been able to pick up the mantle and run with it a bit. But for those who haven't looked at it or are not familiar with it, it's called the Dental Legacy Foundation. We have a website, you can check it out. We unabashedly ask for donations. It is a 501c3, so we are a nonprofit organization in that sense, completely separate entity that we promote and run. And then for prospective docs that maybe are interested in going over to Tanzania and helping out, please contact us. We'd be happy to answer any questions that anybody has on that. And it's a really noble effort and a really cool cause, and who wouldn't want to go to Africa, right? So pretty cool. So what's next for you now? It's retirement. The sunset's coming. What are you going to do? I can't imagine you riding off into the sunset. So what's next?
Oh my goodness. I just like to look at it like I'm closing a door in one career kind of a little bit. I mean, I see what's going on. And I'm just excited to see as the new door opens, what opportunities I have. So to say like, okay, what's out there? Everything. And that's what I like, is everything. Now, do I still need to get up at 4:30 in the morning and work out and then get ready and check my emails and do all those kind of things and then work until 5, 6, 7 o'clock at night, come back home, eat dinner and check my emails? No, I don't have to do that anymore. And so that's going to be really fun to, be like that. But I'm kind of a routine person. I like routines. I like positive routines. Number one. Number two is both Sherry and I, that's my wife, will never stop helping other people. So we'll be looking for opportunities to serve humanitarian missions, church missions for our church, just by going, whether it's in the States or whether it's in a foreign country, on and off. And then in between time, have fun with the grandkids. I like to mountain bike. I want to be able to mountain bike like on a Tuesday at 11 o'clock when the weather's really good, instead of like Saturday morning at 6:30 before the weather gets really hot, because I'm from Arizona. Golf, and do some hobbies like that. I plan on relearning piano. That was the only thing I quit in my whole life. I'm really sad about that. But I kind of want to do that as something to stretch me mentally. And continue to be a lifelong learner. I might tag along with these guys because they feel sorry for me, and we'll help wherever we can. There's just so many a myriad of opportunities. I just look at like life's got an abundance of good things that we can do, and the doors will open, and we're the kind of people that will walk through those doors.
That's awesome. Yeah, we're not letting him out. We've tied him up, so we're gonna keep him coming to these things. We make it rough, It's been really hard here. It's been like 80s, sunny every day. The scuba was pretty rough, We saw a lot of beautiful things. The food has been unbelievably good. We've had to eat a lot of it.
Ate a lot of food.
It's tough. So anything else? Any other contributing words of advice or comments or anything else you want to say before we wrap this thing up?
There's two ways to approach life, and there's two ways to approach dental school and your career. And Stephen Covey was the author of this, and I've seen this through my whole life, and I see it here with this group. This group has this. So it's either have an abundant mentality, and I'll get into the law of abundance, or a scarcity mentality. So if I could say anything, the students, I'm starting with students, the students that have, there is plenty for me and plenty to go around, meaning I'm going to go ahead and I'm going to work my hardest, but if you need help, other dental student, I'm here to help you as well. If you need help, faculty, I'm here to help you. That's the abundant mentality, is I don't have to worry about, oh man, I found out from this one person these 5 questions that are on this test, and I'm not telling anybody because I need to get an advantage over all those people. That's the scarcity mentality. The same thing happens in practice, whether you're in a group practice, whether you're within a community. My partner and I never worried about competition in the community. We said, bring it on, put somebody else there. You know why? Because we always treated our patients the best we could, kindly, honestly, ethically, bend over backwards for them. And we just figured there's always an abundance of people that would want to come see us because we had that mentality or mindset. And I would say going into practice is the same way. You know, you've been blessed. If you're listening to this, you're thinking about going into dentistry or in dentistry, you've been blessed beyond belief if you've gone into other parts of the world. So if you take that and you have that feeling like, I've been really blessed, I want to give back. And if you say, I've got that abundant mentality where I want to give back, and you do that, the bucket will always be full in your joy and happiness in life. Always be full.
Yep. Thank you. That's fantastic. Well, appreciate you, Dr. Smith, coming.
Thank you.
Being here with us, and we just love having you and Sherry with us, and we're grateful to be able to hopefully share some stuff with people that. This is our first ever blog, by the way. Woo! So we came out firing with the big gun. So thank you very much for doing this with us. And as always, you can contact us by way of email. We're available to chat. We'll happily give away Dr. Smith's home phone number if you want to talk to him. No, I'm just kidding. But we can. He is someone that is actually willing to talk to pretty much anybody. So if we can ever help with anything, let us know. So thank you very much.
All right. Thank you.